Check. Okay, welcome back, everybody. We're going to move into our next part of the agenda, which is the fireside chat. So I'm going to ask the participants and the moderator to come up. Just a couple of quick things here. Yesterday there was a blue iPad that was at the back of the room on one of the tables, and that is no longer there. So if we can keep an eye out, if anybody's seen it, picked it up, please turn it in. Somebody is missing that. So again, a blue iPad. Couple other things here. There will be a closing banquet that's sponsored by M. Hardeen and Bridging Finance. There are still tickets available at the cashier's desk in the lobby if you don't already have yours. The other thing to point out is there's going to be a consortium, a national consortium on the business side of cannabis. That is going to be an impromptu meeting here at lunchtime. Again, in parallel to the policy work that we're doing at the National Hemp and Cannabis Working Group, this group is looking specifically at the issue of assets, capital, and the business side of cannabis. And I think it's a wonderful opportunity for everybody to gather. So again, can we get our fireside chat folks up here? We're going to move forward. And again, welcome back, everybody, and good morning. Miigwech.
Good morning. My name is Karina Kesserwan, and I'm a lawyer and strategic advisor, and I'm here with Andrea Payne, who is Director of Government Relations at Aurora, and Jonathan Zaid, who is Director of Advocacy and Corporate Social Responsibility. And Andrea and Jonathan, you both have amazing stories, amazing personal stories that bring you to work in that industry. I'll start with you, Andrea. So Andrea, you are a former citizenship judge, and you also work in politics for over 20 years on both provincial and federal levels with different ministers. You studied journalism, law, and political science. So what brings someone like you to work at a cannabis company?
Good morning, everyone. As Karina said, I'm Andrea Payne. I'm the National Director of Government Relations for Aurora. I would like to really sincerely thank the Tsuut'ina Nation for having us here today. We're here to listen, to collaborate, to share our knowledge, and particularly to talk about the cannabis plant and the wonderful opportunities that it has given both us on our side as corporate and many of you as individuals and communities. So I'm very happy to be here, and thank you very much. Great question, Karina, about how I got involved. I think the commonality in the cannabis industry with licensed producers is the passion we all have for the job that we're doing and for the company that we represent. Certainly, I don't think I would have been if somebody asked me 10 or 15 years ago whether or not I was going to be working for a cannabis company, I probably would have laughed. Most of my experience has been in government, both at the Quebec provincial level and also at the federal level. I spent almost 10 years in Ottawa as well. So, and then for the 3 years before I started with Aurora, I was a citizenship judge in Montreal, where I represented pretty much Quebec and anything east of Quebec. So it was a wonderful career, really enjoyed it. And then one day, Cam, who apologizes for not being able to be here today, he's our Chief Corporate Officer. He's also a dear friend of mine, and he called me up, and we were just acquiring the production facility in Pointe Claire, Quebec. And he said, I'm working for a company now that I'd like you to consider coming to work for, and I would have been the first boots on the ground in that facility. Strangely enough, when I finally did decide to join Aurora, I did. I have 3 daughters. They're 24, 22, and 18 now. But, I told them, when grandma comes to visit, please don't tell her I'm working for a cannabis company. Tell her I'm working in biopharma instead. So that was probably the stigma and at the beginning of our industry. And once it became more serious and you started to get people coming in from all walks of life, people that had worked with government, people who were experienced in marketing, other very scientific folk who do a lot of research and development. There are a whole bunch of us that started coming in to work with the company and made it what it is today. I started in May of 2017. Back then, I think we were 300 people in the company. Now we are 1,500 people and growing all the time. So it's a much different thing, but we're very passionate and we're very, very looking forward to the future of the industry and where it's going to bring us. Canada is at the forefront. Canada are the leaders of this industry. The people worldwide, everyone worldwide is actually watching us and looking to see how we have achieved legalization and where we're going from there. So I'm very proud to be part of this industry now.
Thank you, Andrea. And speaking of leaders, Jonathan, you have been recognized as being a leader in cannabis policy, taxation issue, and accessibility issues even before you joined Aurora. You founded a nonprofit yourself, a very important nonprofit in the subject called Fair Access to Medical Marijuana. And you were the first individual in Canada to successfully advocate for a major insurance company to cover the cost of a medically prescribed cannabis. Can you tell us about your story?
Yeah, so my story, I think, like lots of us in the cannabis space, come from a place of personal life experience. So about 10 years ago, I was diagnosed with new daily persistent headache, a chronic neurological condition that causes 24/7 headaches, migraines, and insomnia. And I really struggled at the beginning, had a low quality of life, tried all the prescription drugs and interventions, and the traditional medical establishment, Western medicine, just didn't work for me. So I turned to medical cannabis. And at the beginning, it really helped. It was the first time in about 5 years where I slept throughout the whole night. And there's a lot to be said for that for someone in chronic pain. But I realized very quickly there was a whole host of access issues, including insurance coverage, as Karina mentioned, facing medical cannabis patients. Because this medicine worked for myself, for chronic pain, and so many others, it was a really beneficial thing at the personal level. But at the same time, there was not as evolved industry at that point, about 4 years ago. And there was a lot of access issues. It was hard to get a physician to support an authorization. But then even if you did get one, how would you go about it? What education was available? And beyond that, how could you afford it for someone like me at the time who was a student, or many other people with chronic complex conditions that have low incomes? It's very difficult to afford your medicine when you're not working at the same time as well. So I founded CFAM, as Karina mentioned, a nonprofit patient advocacy group, and advocated for insurers to cover medical cannabis. And this is a conversation that's still ongoing, and I think earlier this morning it was touched on from the Indigenous perspective with NIHB, and that's a file that I continue to work on as well. So I come at this from a patient perspective, and I think Andrea mentioned that we're all really passionate. I think that's something that we all share, the passion for cannabis and how we can work together to further access and the opportunities available.
And Andrea, you also have a very personal story that brings you to Aurora.
Yes, I was also diagnosed with breast cancer 11 years ago. I underwent a double mastectomy and had reconstruction surgery, and then that was followed by chemotherapy, 8 rounds of that. So I underwent a full year and a half, I would say, between surgeries and chemotherapy of treatment. And that's when I started reading up about cannabis as well, and started following the evolution of some of the cancer centers who were also including cannabis in their treatment, particularly for pain management, but also for patients who were undergoing chemotherapy who had lost their appetite and were losing a lot of weight. And cannabis was also instrumental in allowing them to have better appetites and to keep nourished. So I think today that there are some cancer care centers that do allow patients to follow some cannabis therapies. Some try to use other forms as well. I think basically it depends on what kind of treatment your doctors want to use and what they're comfortable with you following. So we always say, make sure that you follow doctors' directions. But in my personal case, my interest in cannabis, following that and following my illness, was also compounded by the fact that I was asked to join the company. So there's my story.
And you're clearly very passionate about your work, and so are you, Jonathan. And I'm sure people in the room also wonder what kind of jobs can they have in that industry. So what is possible as employment in a company like Aurora?
So Aurora now hires people in from all sorts of walks of life. There are people that really understand and know the plant very intimately, know how it grows, know how to trim and treat it in a way that it will be very productive. So we have horticultures, we have science folk that understand the plant and can work with them. The scientific folk as well also work on research and development and moving forward. So we have people in those fields. We have biologists. We have people that are trained on regulations and are experts on regulations. And as you can well appreciate, we have a lot of regulations that we have to abide by. So we have a team that are actually providing advice for us moving forward on the regulatory side. We have people like myself who have been involved in government for a long time, and we continue to meet with government at all levels, whether it's provincial, municipal, or federal. We also talk with Indigenous communities. We hold meetings, we provide advice. When asked, we will go in and speak with band councils on whatever their communities require. We have people that are marketing experts, for example, and as you can appreciate as well, because we're not allowed to promote or brand our products anymore, the marketing aspect is a very big challenge for anyone who's involved in marketing. So as you could see, we have a variety of people that can be and are involved in our company, even from human resources aspects, because we're hiring at such a rapid rate. We need to have departments that are equipped with people that can screen and get individuals in for interviews, and people that can manage. We have a production facility. I work from one of them in the Pointe Claire facility on the island of Montreal. And so you require someone who can actually manage all these people. We have 60 individuals working in our facility right now, and it keeps climbing. So we require people that can actually manage and provide schedules for all these people. We also have a very serious security component with our facilities as well. We have 24-hour security 7 days a week on all the 8 facilities that we have in Canada, and that's also as per Health Canada regulations as well. We have just as an example, in the Pointe Claire facility, we have 120 cameras around our facility, inside the rooms with the plants and on the perimeters and around the vaults, and that's something that we require to keep footage for a period of 2 years. So we have a security team at all our facilities as well. So as you can see, there's a very large and big choice of opportunity and possibilities of employment for Aurora.
And what kind of educational training can people get to prepare themselves for those jobs?
That's an interesting question because in Montreal, there are universities now and colleges that are starting to get very interested in initiating courses of their own. For example, McGill University, combined with John Abbott College in the Montreal area, will be offering a course starting in January for those who are interested in learning on the horticultural side of more of the growing of the plants. So we're in discussion right now to see how we can help out in that aspect and provide internships for the students that are working there to come in and actually get hands-on knowledge and learning from working with the plants.
Thank you, Andrea. And Jonathan, you have a very interesting title at Aurora. So you're responsible for corporate social responsibility. And so what does corporate citizenship mean to you?
In terms of the way that Aurora approaches corporate citizenship and corporate social responsibility, we see it it's a responsibility of ours to make sure it's at the heart of everything we do, and it's within our corporate DNA. So what that means is all the decisions we make are centric to around CSR, and so whether it's environmental sustainability considerations, community engagement and participation, employment opportunities for communities that we operate in, and also advocacy. So there's a few advocacy issues. I mentioned NIHB coverage and broader insurance coverage for medical cannabis is an issue that we feel really strongly about, that medicine should be covered, and medical cannabis is a medicine that should be covered. And the other issue that topic rather, that we've been really focusing on the past few months and year is on amnesty for personal possession offenses. We know that certain communities, including Indigenous communities, have been affected by prohibition at a disproportionate rate and have been criminalized. And those charges continue to carry burdens for people that have them, whether it's finding employment opportunities, traveling, volunteering. So we're happy to see the government make a step in the right direction in terms of allowing pardons or record suspensions, but this doesn't necessarily fully adequately address this disproportionate policing that has occurred. So those are the types of issues that we really care about and continue to take a strong stand on, in addition to the broader CSR programs and partnerships that we continue to explore.
And I think also education and harm reduction is something that you work on. Do you want to speak about that, Andrea?
We're actually, in all the communities where we're involved, we take pride, and it's part of our corporate responsibility as well, to go and give back to the communities. And part of that is having discussions at local libraries, for example. In Point Claire, the mayor called us up one day and asked us if we would be amenable to go and talk to a group of people about safe use of cannabis, and to talk a little bit about the cannabis industry, because most people don't really understand what the cannabis industry is all about at this point in time. With legalization, things have become much more clear, and we've started to see through newspaper reports and other things where we're getting a little bit more knowledge about the cannabis industry, but it still widely has that stigma where people think that it's being grown in the backfields and through illegal sources, and not really, the stigma is still partially there. I think anyone that comes to one of our facilities and does a guided tour has a much better appreciation of what the industry is all about. It's similar to going and visiting a pharmaceutical industry, for example. When you come into one of our facilities, you have to put on one of those silly coats, lab coat type things, and cover your hair, cover your shoes, wear gloves, wear protective glasses. That's all part of going and visiting one of our facilities. We also have tags where we can, for security purposes, badge in and out of different rooms, and only certain people, you can only be accompanied by certain people who have security background checks by the federal government and the RCMP that are allowed to bring groups around and be in the presence of the plants. So, it's quite a different experience for anyone who actually comes to visit one of our facilities and sees how it actually works and all the constraints around it. We're GMP certified, which means that's good manufacturing practices. We also export to Europe, so we need to be EU GMP certified, which means we have to be very mindful and careful of our growing practices and the cleanliness and security of our facilities.
Just going back a bit to what you said about going to high schools and to speaking to young people, how does that work, and can your material be adapted for Indigenous communities?
Absolutely. Going into high school, we've spoken at high schools as well, basically to the senior students there, where we do talk to them about responsible use and the fact that the data is out there that they shouldn't be consuming before the age of 21. So we do share that information with students, and we remind them that of some of the consequences of using it earlier. We feel very strongly that the more information, if you take an example of the biggest users in our country, is actually the age group of 24 and under. So this is 70% of the 24 and under age group consume cannabis in our country. They're the ones that in the 100% of consumption in Canada, 70% of them are young people. So we feel very strongly that they need to have the information at hand to make the proper decisions moving forward. And they're very fortunate in getting that because when I was growing up, for example, we weren't told about alcohol consumption and some of the dangers affiliated with that either. And I feel that young people are invincible, but on the other hand, I think they're smart enough to take that information and make some intelligent decisions with it. So we go in and do speeches at high schools, at community libraries. We've been to cancer wellness centers, for example, speaking with patients there. And it's all about responsible use, and a lot of people haven't necessarily used it. One of our bigger age group for consumers with our company on the medical side are actually older adults, and they use CBD oil and CBD capsules. And that's mainly for pain relief. And so when they're starting to use CBD oil or capsules, they don't necessarily know how to start it. So we provide some of that information about starting slow, starting low dosage and going slow, because some people, especially if they're ingesting it, don't realize that it may take a while before it will react, similar to taking a Tylenol or an aspirin. So this is the type of information that we share with people, and we're more than willing and interested in meeting with Indigenous communities as well and sharing our experiences and learning from your experiences as well.
And Jonathan, you're a young person, and from your story, you had to use cannabis as medicine at a young age. So there's obviously exceptions as to when it is safe. And your life has been changed by it. And have you seen other patients, including Indigenous patients, whose life have been changed by cannabis?
Yeah, it's absolutely remarkable, the stories that I've heard and we continue to hear about patients' experience with medical cannabis, and very similar to myself, where other traditional medicines and pharmaceuticals wouldn't work necessarily, and medical cannabis was the answer for them. And I think it's important that we recognize some of the evidence that's out there, and some of it is anecdotal. There are continuing to be clinical trials. We have 23 current clinical trials, and I think 6 preclinical trials right now. So there's a lot of R&D that's happening. But while that continues to happening, as it should, I think it's important that we look at patient access and ensure that patients are getting the access that they need, getting the education that they need, so they are able to achieve the health goals and objectives they're looking for. We talked a little bit about education and harm reduction, and that's an important point, because if patients are left to fend for themselves and self-medicate, I don't think that's a positive solution. Whereas if they have the proper education on how to use cannabis as a replacement for opioids or alcohol, that can be a very positive experience. So it's about using it in an educated and mindful way as well. And certainly I've seen a lot of really positive stories, people that are in chronic pain, not having as much pain. There's certainly a lot of incredible anecdotes coming out of the epilepsy community, especially pediatric epilepsy that's extremely treatment resistant, where kids are having potentially hundreds of seizures a day and using CBD oil as a treatment for those symptoms. So the anecdotes are out there, the research is happening, and we need to ensure patients are supported in that process.
And you have been bringing that message across the world. I think you've been in many places. Maybe you can talk about your international advocacy.
Yeah, so I think in a lot of ways it's important to have this conversation here, but we have to also recognize that being in this country, we're really blessed in a lot of ways how far our drug policy has progressed. And because of that, there's a lot of opportunities. There's opportunities to export internationally. As Andrea mentioned, we are EU GMP certified, which means we and many other LPs who are also active in international markets. So the opportunity is in Canada right now, but it's not just a Canadian market, it's a broader market than that. And certainly patient advocacy and education is important wherever we are and wherever people are using it, which is all over the world. And now it's about ensuring that it's regulated, quality controlled, and people are going about it in a responsible way.
And so different countries are looking at those regulations, and also different Indigenous nations across Canada are looking at what kind of regulation they can have in their community that reflects their values and their needs. And I'm sure you are having a lot of discussions with different Indigenous community members. How can people prepare when they come from Indigenous community to come and talk to you to make it a productive meeting?
The first thing I think is having a conversation within the community, seeing where the priorities are for your own community, and then, but also looking at within those priorities and understanding the market that exists currently related to cannabis, because it is a very large market that's grown very fast over the few years. So there's a perception that it's really easy to make money in this market, but it depends what your business is. So it's important to come to the table with an understanding of what opportunities, what niche that you could fit into potentially, because there is so much to do, and it's not just about growing the plant, it's everything. And when I say everything, I really mean everything. It's everything from legal services, accounting services, third-party other services, quality control, testing, facility design and construction. And so the opportunities are endless. It's about understanding the market and where the opportunities are that best fit the community's needs as well as the business objectives. And certainly at Aurora, we're happy to discuss those kinds of and have those conversations with communities and see what makes sense in terms of partnership or other services.
And I can just add to that as well that we have, we're very mindful of our environmental footprint as well. So part of the companies that we've also invested in are things like Micron Waste Management, where we do the proper disposal of our plants, or water recycling. We also have a partnership with Larson, who are our design and engineer consultants, who at this point in time build and design all of the facilities that we're putting not only in Canada but around the world. They're right now we're building something in Medicine Hat, but we're also building a facility in Copenhagen, just outside of Copenhagen, Denmark, where we will be producing cannabis for the European market as well. So the environmental footprint, because our Larson projects are designed in a way that they are solid buildings with glass roofs, we follow through with using natural elements as much as possible with our growth cycle. We're also equally proud to say that we do not use pesticides in our growth as well. So there's that angle as well. And if that's something that you want to learn more about or get our support for, come by and talk to us at our booth. We're around and able to have discussions as well.
And what kind of questions do you have for communities? Because they have a lot of questions for you, but what kind of answers would you like to get from communities who interact with you or who just participate in these kind of events?
Well, I think Jonathan started touching on that. Obviously, it's to have a sense of what your community wants to do in terms of being involved in the cannabis industry. So it's how you are responding to the needs of your community, and that would give us a better sense of how we can provide that support moving forward. It's also, do you have business development teams there? Do you have a business plan, for example, that you've put together, which would indicate indicate as well that you're very serious and have put some thought into what the needs of your communities are and can present those in a very succinct way to us. And that gives us a better idea of how we can provide our support to you in moving forward. There are very many components to involvement. They could be anything from production to retailing to the educative component that we were talking about. And also there are some communities that are in tourist areas, and that's an interesting component as well.
And do you have any question from the CSR perspective?
Yeah, I think Andrea touched on the big ones, but the same applies for CSR. So in terms of specific partnerships, understanding what the needs are and what we can do. So we have teams from science, from advocacy, and so it really depends what your needs are, and we're happy to have those conversations. But having a good understanding of what the community is facing as well, and certainly will help us evolve and become as effective to work with as possible.
Well, thank you so much. Thank you for sharing your stories and your passion and your commitment at Aurora.
And thanks to everybody here. We hope you gleaned a little bit of knowledge out of our little fireside discussion. And thanks for joining us today.
Thank you.